Good morning. My name is Jazz. I'm a physical therapist that just had spine surgery. I've had my L5 and S1 fused just recently, maybe about 25 days ago. I've been posting these videos, and it seems like a lot of people have been asking how I got to the point that I got injured enough to go to get to the surgery. So just a quick background. I've been active most of my life, ever since high school, played a lot of sports. Um, the first time that I felt like I had a back injury was actually when I was studying in university, studying up my bachelor's for physical therapy. I always noticed that there was a knot on the left side of my lower back. Usually it's precipitated by me playing basketball or lifting heavy or doing something, but I always had that knot. Now, it wasn't enough for me to sort of it was uncomfy enough for me to seek some medical advice, but usually like ibuprofen would help. Um, and that went on up until, I don't know, like 2024. That's when the real injury started for me. So I believe December of 2023, leading up to January about 2024. There was snow here where I was. I was shoveling the garage to clear up the cars. As I was doing that, I felt like a sharp pain at the side of my back. But mind you, it was cold outside. It was really snowing. I was shoveling, so I still cleared the driveway, went back inside the house, rested, and it felt fine. The preceding weeks after, I started to notice that my left butt cheek going towards my right butt cheek just felt different. It felt, how would I say it, numb. Yeah, I guess that's how but it wasn't numb per se right away. But when I was scratching my buttocks or the side of my butt or my hamstrings or the side of my thigh, I just felt it different. It felt a little numb. I was still working as a home health therapist then, and it progressively got worse. In my earlier video, I did mention about lifting a stroke patient, and that exaggerated the symptoms for me. So it was numb, going down the side of my thigh, not in the middle of my thigh, but just down the sides, underneath by my hamstrings and close to the back of the knee. I'll show you some images of the MRI. Since I went to the doctor after that, I was concerned as a physical therapist. I knew that there was something wrong. So I went to my orthopedic doctor, neurospine doctor, and I had some imaging done. So the MRI revealed severe spinal stenosis on that level, L5 and S1, some disc bulge, some herniation affecting me. So I took everything conservatively. I did physical therapy on myself. I rehabbed myself. Didn't lift any heavy weights. Stuck to walking. Did a lot of core exercises. And then in about 6 months, it felt better. But stupid me, 6 months down the line, it did feel better. I slowly got back into playing sports. There was this basketball league that I was involved in before, and I sort of joined again because I was feeling better. I wanted to play again. It went fine up until February of 2025. I was running up and down the Hort. I know I've told this story before, but I was running up and down, and then my left leg just suddenly didn't move. And I was so scared. I thought it was cramped. I stretched. I tried to play again. It just wouldn't move. Didn't think about my back initially. And then I was walking up and down the grocery aisle a few days after, and I felt that really bad cramp again. So it was just progressively getting worse. And then I went to my doctor. We did another round of imaging, and it was progressively worse. Well, not as far as the imaging was concerned, it was bad enough to begin with 2024. But when they did the imaging again, the MRI on 2025, it was the same problem, but much worse. And then the symptoms just started to progress. I couldn't walk 2 miles. I had to stop, had to sit down. My calf was aching, and then the distances that I was able to walk progressively got shorter, from a mile, and then to a block, and then to half a block. I'd have to sit down up and down the stairs in my house. It was terrible. My quality of life was really affected. And then, like I just spiraled out of control. Not like I went crazy. Mentally, I did. I just felt really bad. So I talked to my doctors. I was open to surgery at that time, but I wanted to avoid it as much as possible. I scaled everything back again, light weights, a lot of core exercises. Nothing seemed to help. Did go for a round of corticosteroid shots down that L5-NS1. It was a little scary. In my previous video, I did mention that I was afraid of needles, but it was pretty cool. I was lying down. I think they had this big X-ray machine where the doctor could see as he was going in with the needle in my back. It helped for about 2 days, partially, I think, because I just wasn't moving and I was scared of the procedure. But then I slowly started to try and walk again. There was this incident where it started to rain. My kids were in the bus stop. I needed to run back and grab an umbrella. So I slightly, like a very gentle jog, and I wasn't even like halfway going from the bus stop going into the house, and then I was limping. I was dragging my leg just to get the umbrella, and then I found myself having to drive my vehicle to go to the bus stop to give them the umbrella. In any case, and then after that, and that's when it all started. As far as like me talking to my doctor again, look, doctor, didn't help, and then we decided to push through with the surgery. In between the video, you'll see clips of the 2024 MRI imaging and the 2025 imaging. Hopefully this gives you an idea as to what happened to me. I know a lot of people are asking, or curious about it's pretty much the same symptoms for them or close to. Just a disclaimer, the spine is a very complicated anatomical structure. There's a lot of things that could go wrong to cause pain. There's pedicles, there's the disc, there's arthritis. There's so many things that could go wrong with the spine. So it's not necessarily my condition is like the same for yours, but the symptoms are somewhat the same, that numbness, that tingling, that difficulty walking, the really bad quality of life that you have just because of that pain. Like I said, feel free to ask questions. I'll try to post more videos about this one. I hope it helps. So hopefully the imaging helps, and then this video just gives you an idea what to expect. Take care, guys. So this is the side image of me. This is my injury 2024. I highlighted in red where the area was, so that's my L5-NS1. So there was some swelling. It wasn't as bad 2024. And then upcoming is this is another image for 2024. I think this is a front or the back version of it. But yeah, as you can see, my L5-NS1 were just shot. Everything looked terrible. The other discs above and below seemed fine. And then this is the 2025 one, a side angle of the 2025 injury for me. So as you can see, it got worse. There was some bulging behind. Basically, I had no disc, and that space that was impinged was causing all the symptoms for me on my left side. Anyways, I hope the imaging helps. If you have the same image or whatever it looks like, hopefully it gives you an idea. Thank you.